Happy Friday, everyone, and welcome back to another episode of NHLN Opinion Plus, a new weekly series coming at you every Friday. This is a space for our opinions where we talk about current events and questions the Latino community are curious to know. Today, we are joined by Moira O'Neill, Director of the Office of the Child Advocate, who was appointed to be the office's first ever director in 2018. Prior to her current position, she was an assistant child advocate for the state of Connecticut for 11 years. Welcome, Director O'Neill, and thank you for joining us today.
Thank you, Balaam. It's delightful to be here.
It's a pleasure. So we're going to jump in if that's all right.
Great.
So a new law was signed and enacted this past August that expanded the Office of the Child Advocate's oversight to all state agencies, along with some public and private organizations that provide services to children. First off, what has the first few months been of overseeing all these new entities look like? Basically, how has the transition to your current operations like?
Okay, thank you for that question. This is actually really an exciting time because the Office of the Child Advocate has only existed for 3 years. So the fact that our jurisdiction has been expanded so soon is really a vote of confidence on the work that we've been doing so far. But to answer that question, let me just step back a little bit and explain. The Office of the Child Advocate was established as an oversight agency of child welfare. So that was over the Division for Children, Youth, and Families, which is in charge of juvenile justice services and child protective services. So when children are abused or neglected, or when they are adjudicated for committing crimes, the Division for Children, Youth, and Families, or DCYF, is in charge of them. So the Office of the Child Advocate had oversight of that agency alone. And we were also mandated to promote the best interest of children. So after these 3 years, it was decided and the law was passed and went into effect only in mid-September that we now have jurisdiction over all state services for children. So that includes, it sort of sounds funny, you were reading from the statute, but it's essentially what that means is anytime that the state provides services to children, or they provide funds for a private provider to provide services for children, or they have some arrangement with someone, we have oversight of that. And that means that we can check in and make sure that we're serving children the way they need to be served, that their needs are being met, and that their best interests are being protected.
That's amazing. All right. And so how has it been transitioning to that in terms of like your regular operations?
So the transition is, we don't expect it to be too dramatically different, because essentially, if you think about a child who becomes involved with any state services, particularly child protection or juvenile justice, which is the children that we heard about before, invariably they're going to be involved with other services. So a child who is abused or neglected and comes into this, say, foster care, they're going to have Medicaid, so that's health care. They're very likely going to have mental health problems as a result of these adverse childhood experiences of being abused or neglected. So that's behavioral health care. They have to go to school, so they have to be educated. So really, it's more of an expansion of us being able to reach out to all of the areas where the state is serving children and say, hey, come to the table and talk with us about how we're serving this children. We've heard that there may be a problem here. So it just sort of expands our purview to be able to include more people to problem solve for a child.
Okay, thank you for that. And so how can the office's greater access to confidential information across New Hampshire now, these state agencies and others, how can this help your work on policies? I read a little bit about that.
Yeah, thank you that's a great question too, because actually the currency and the power of the Office of the Child Advocate is our access to information. Because you can imagine that all information about children and their lives, especially in the scenarios where they need help, where their family has experienced some dysfunction, there's a lot of private information. And so really there's both a level of state law and federal law that protects all of that information. So the Office of the Child Advocate is very privileged. And oftentimes, if we were to bring around the table all the people working with children, we may be the only agency that has the whole story. And it's in a child's full narrative that we can usually find ways that to resolve problems. So for example, if the child was involved in juvenile justice. So suppose the child assaulted someone at school. It's possible that when that child went to court, the child's lawyer, the juvenile probation and parole officer, the judge, the other people who are involved may not know that the child had actually been abused as a child and had a difficult situation at home. So holding the child accountable needed to include also, how can we help this child provide therapy, get the child into some services, and also connect with the family to make the whole system better. And that's what the child advocate can do. We can look at the entire record of the child and say, this child's been in trouble for a lot, but actually he's supposed to have special education at school. And whatever this child's special ed need is, it will affect the way that child thinks through a problem and might get him into trouble if he doesn't have the right guidance. So when we have that whole story, we can bring it all together, and then people can come up with the best plan for a child to do better. And for the family to be able to better support the child.
Okay. So it seems like, talking about how these policies, they help and they influence individual children, but also on a broader level, like all of these children that have similar experiences. So what would be the policy goals your office is working towards, if that makes sense?
Sure, thank you. And I think you asked me that question. I didn't quite answer it. So we receive information and we take action in several different ways. One is that we receive complaints. So people say this child's not getting what they need. We also receive reports of incidents. So a child is in care and they've experienced restraints 3 times this week. So we take all that basic information. People call us, we read children's records, we bring people together and meet, and we start to see trends from child to child. Like, this keeps happening, so we really need to look at it. Children are being restrained at a high level. We need to go to the policy, which is RSA 126U, is a law that restricts the use of restraints on children for emergencies only. So we see that maybe it's not always an emergency that people are restraining children. So then we can say on a policy level, number one, what does the staff know about the law? What does the staff know about child development? What does the staff know? How have they been trained and supported so that they don't have to restrain children? And if that doesn't work, we might go to the legislators and say, we need to adjust this law so people can better understand what's allowed and what's helpful for children. So some of the policy issues that we're looking at this year happen to be, one is looking at how restraints are used on children. We had a report that went out back in January about the use of restraint. We're also looking at access to mental health care. There was a great law passed a year and a half ago, Senate Bill 14, that created vast community-based services, including mobile crisis response. So we're going to be pushing on the policy level to get that law implemented, especially now during COVID. People really need to have that extra support at the community level, so we don't have children backed up in emergency rooms having crises that could easily be dealt with at home with professionals visiting at home. So those are some of the areas. Because of the expanded jurisdiction, we have a lot to learn about education. And certainly under COVID, I would imagine that an issue other states around us are seeing is, how do we advocate for children who need special ed services when they're working remotely with school programs? So it's a wide variety of things.
Thank you for explaining that. Yeah, it was very in-depth. So along with this new law, your department, as we briefly mentioned, can take action when you receive more information about children exhibiting warning signs, rather than wait until the Division for Children, Youth, and Families to take notice. I read it in an interview with Concord Monitor. You said a few weeks ago something that stuck with me: same child, earlier intervention. And I was wondering, what can earlier intervention mean for a child? What is the importance behind it?
Well, it means a lot. And it's interesting because in the research around child development, we're finding the most helpful thing for kids to grow up and reach their full potential is for parents to really be equipped to understand what to expect of children from infancy on, just to understand basic child development. And where we're seeing some problems with that are children who are born exposed to substances. New Hampshire has a terrible problem with substance use. And so there are a lot of infants who are born exposed to that. And we know that they will have some long-term developmental issues. We also see children who have had adverse childhood experiences, children who are exposed to violence, exposed to substance use, exposed to mental illness in their family. All of that affects how a child's brain develops over time. And so if we understand that early on, we can prepare parents to know what to look for when a child's not developing well. And so that early intervention is so important and has such great outcomes. So it's something as simple as a home visiting program where after a child is born, a nurse visits the house a few times and just reviews with parents like, this is okay, this is how your child is supposed to develop, you're doing a great job with this, encourage them, help parents to know where the resources are. And then it's not so frightening or daunting to be able to monitor your child's development and also recognize when things aren't going as they should be and getting the kind of help that you need. And so if children come into the school system developed and healthy and curious and able to ask questions and learn, then they're going to do better in school. When children do well in school, they get jobs after, they're functioning in the community in a pro-social way. So all of that comes from those early days, early months, and early years when we really support parents to understand children and be able to provide them with what they need.
Thank you. That is amazing. Yeah, it is such a difference, and you captured that pretty well. Lastly, I'd like to briefly talk about any impacts COVID-19 has had on your operations. Since children are spending most, if not all of their time at home now with online schooling and remote interactions with friends and family, more time with their families can mean very different things. And so I'm wondering if your office has noticed any rise or decrease in children requiring your services like that.
Yeah, we have, right away we saw, and we've talked about this a lot, thank goodness, in the public. We saw people, everyone in New Hampshire is a mandated reporter if they suspect abuse or neglect. So everyone should be reporting that. But for the most part, the majority of referrals about suspected abuse and neglect come from school. So nurses and school teachers and guidance counselors. And when children weren't in school, people weren't seeing them. They were sort of out of that safety net. So we did a lot of pushing for a community conversation about that, getting people to talk, and even some people developed some education around what to look for when you're communicating with kids via the internet. So sort of building up the strength there. We also saw a problem of children who were institutionalized, children who are in group homes and what they call residential treatment because of the COVID restrictions. They couldn't visit with their families. They couldn't visit with new families if someone was up for adoption, and you couldn't make those human connections. And again, this week, a lot of those programs have closed to visits, and that will have a big impact on children. So we spend a lot of time talking about that, working with other leaders in the department and other providers around the state to try to sort of problem solve around how do we meet children's needs, keep everyone safe from a virus, and let children move on to permanency as they all should.
That's a lot you're working on there. Yeah, it's such a unique situation wherein I can't imagine all of the, creative type of solutions and thinking that has to be involved now. But thank you so much for talking with us, Director O'Neill, and for being our guest on NHLN Opinion Plus today.
Thank you for having me. I always love talking about children, and I appreciate when people cover their interests.
It was great learning about this. Yes, thank you. So everyone tune in next week for another episode. Follow us on Twitter at NH Latino News and Instagram at NH_Latino News. I'm Belen Dumont with NHLN Opinion Plus. See you next time.